Hey everyone, and welcome back. We're diving deep into a topic that's often misunderstood. Borderline and antisocial personality disorders.
Yeah.
We'll be using the 2015 quality standard from NICE as our guide for this deep dive.
Whoa, nice.
Yeah, the UK's National Institute for Health and Care Excellence.
Right.
Before looking at this, I had a lot of assumptions about how these disorders are treated.
Okay.
But this document has really opened my eyes to the nuances of diagnoses and the surprisingly important role of therapy.
It is fascinating how much emphasis NICE puts on getting that diagnosis right.
Yeah.
They stress the importance of structured clinical assessments using standardized tools.
And they actually name some of these tools in the document.
Right.
Things like the DIPDV.
Oh, okay.
That's the Diagnostic Interview for DSM-IV Personality Disorders.
Yeah.
And the SCID-2, or Structured Clinical Interview for DSM-IV Personality Disorders. And then there's also the International Personality Disorder Examination,
Right.
which is often shortened to IPDE. So help me understand, why are these specific tools so crucial?
Yeah.
What makes them different from a regular chat with a therapist?
Well, it's all about getting a complete picture.
Okay.
These disorders can be tricky to diagnose, you see?
Yeah.
Sometimes they're missed altogether.
Wow.
Or there might be other conditions present that complicate things.
Right.
Imagine trying to solve a puzzle with missing pieces. That's what it's like without a proper assessment.
Okay.
These standardized tools are like a magnifying glass, really, helping clinicians examine an individual's personality traits, behaviors, and history in a systematic way.
So it's not just about slapping a label on someone.
No.
It's about truly understanding their specific needs and any co-occurring conditions. So let's say someone goes through this assessment and a diagnosis is made.
Right.
What happens next? What kind of treatment does NICE recommend?
Well, here's where things get really interesting. And honestly, where I had the biggest aha moment when I first read this document, the primary treatment for these disorders is not medication.
Wait, no medication at all?
Yeah.
That really challenges what I thought I knew about these conditions.
Right. It surprised me too.
Yeah.
The NICE guidelines really hammer home the point that these are personality disorders, which means they involve these deeply ingrained patterns of thinking and behaving. While medication might be helpful for managing certain symptoms, especially during a crisis, the real lasting change comes from psychological therapy.
So it's not a quick fix.
No.
It's more about addressing those underlying issues.
Exactly. Think of it like this.
Okay.
Medication might help soothe the surface waves,
Fine.
but therapy dives deep to address the underlying currents that are causing those waves.
That's such a powerful analogy.
Thank you.
So what kinds of therapy are we talking about here?
Well, it depends on the specific disorder. For borderline personality disorder, NICE recommends offering a variety of psychological therapies. And what's really important here is involving the individual in choosing the type of therapy, how long it will last, and even how intense the sessions will be.
Okay.
It's all about empowering them in their own recovery journey.
That makes so much sense.
Yeah.
If you're going to commit to therapy, you need to feel like you have a say in it, right?
Right.
Like it's a collaborative process, not something being done to you.
Exactly.
Yeah.
The NICE guidelines emphasize that individual choice is absolutely crucial for engagement and success.
Makes sense.
It helps build a sense of ownership and trust in the process.
Okay.
Now, for antisocial personality disorder, the approach is a bit different.
Okay.
NICE recommends focusing on group-based cognitive and behavioral therapies.
Okay.
Which means helping individuals identify and change harmful thought patterns and behaviors.
So kind of rewiring their thinking.
Oh, yeah, exactly.
And just like with borderline personality disorder, the individual has a say in how long and intense the therapy will be. I'm curious, why the emphasis on group therapy for antisocial personality disorder?
That's a great question.
Yeah.
Think about the core challenges of antisocial personality disorder.
Okay.
Difficulty with relationships, empathy, and understanding social cues.
Okay.
Group therapy offers this safe and structured environment for individuals to practice these skills.
Oh, interesting.
It's like a real-world training ground.
Yeah.
Where they can interact with others, receive feedback, and challenge those negative thought patterns in a supportive setting.
So it's not just about talking.
No.
It's about putting those new insights into action.
Yeah.
That's really smart.
Thank you.
Okay, so we've talked about the importance of structured assessments and the surprising emphasis on therapy over medication.
Right.
What else jumps out at you from this nice quality standard?
One thing that really stood out to me was the focus on managing transitions safely. People with borderline or antisocial personality disorders can be particularly vulnerable during times of change, you see.
When you say transitions, what exactly do you mean?
Sure.
Give me some examples.
We're talking about things like changes in their care providers,
Okay.
moving to a new home, or
Okay.
even just shifts in their daily routine.
Okay.
Anything that disrupts their sense of stability can be a trigger for anxiety, fear, and even a full-blown crisis.
Wow.
And remember, these disorders often involve difficulty forming secure attachments.
Right.
So the uncertainty of change can be really overwhelming.
I can see how that would be incredibly challenging.
Yeah.
So how does the nice quality standard address this vulnerability to transitions? What can be done to help?
Well, they recommend a really thoughtful approach,
Okay.
which is creating a structured and phased plan before any transition takes place.
Okay.
And this plan is agreed upon by both the individual and their care provider, so everyone's on the same page.
I like that. Okay, so walk me through what this transition plan might look like in practice.
Okay.
What are the key elements?
It needs to be very clear and concrete.
Okay.
The plan should outline the steps involved in the transition, a timeline for each step,
Right.
and clearly define the roles and responsibilities of everyone involved.
Okay.
And perhaps most importantly, it needs to include a plan for accessing support during a crisis.
Wow, that's important.
Yes, you're essentially building a safety net to catch someone if they start to fall.
That's incredibly thoughtful.
Yeah,
It's like giving someone a map and a compass before sending them out on a challenging journey.
right.
So the goal is to minimize anxiety, provide a sense of control, and ultimately prevent a crisis.
Exactly. It's all about empowering the individual and making sure they feel supported every step of the way.
This is so eye-opening.
Yeah.
I had no idea how much attention was given to these seemingly small details. What else surprised you about this quality standard?
Honestly, I was really struck by the emphasis on long-term goals like education and employment.
Right.
I mean, you wouldn't necessarily think those things would be a priority when addressing personality disorders.
Right. I'm with you on that.
Yeah.
It seems counterintuitive.
Yeah.
Why would a document like this focus on things like getting a job or pursuing education?
Because NICE recognizes that the goal isn't just to manage symptoms, it's to help individuals live truly fulfilling lives.
Right.
And education and employment are such important pieces of that puzzle.
Yeah.
It's about helping them build a life worth living, not just surviving day to day.
That's such a powerful perspective.
Yeah,
It's not just about mental health.
Yeah.
It's about overall well-being and achieving your full potential.
absolutely.
Yeah.
The NICE guidelines actually recommend that these long-term goals be spelled out in the individual's care plan,
Okay.
even if achieving them seems far off.
So it's about planting those seeds of hope and aspiration.
Yeah.
Even when someone is in the midst of struggling with these complex disorders, that's incredibly inspiring.
It really is.
Yeah.
It speaks to the belief that recovery is possible and that individuals with borderline or antisocial personality disorders can not only manage their symptoms, but also achieve their dreams and contribute to society in meaningful ways.
I love that.
Yeah.
But let's be real for a second. Working with people who have these disorders can be incredibly challenging, right?
Absolutely.
I mean, even understanding these diagnoses is a lot to take in.
You're absolutely right. The NICE quality standard acknowledges that head on.
Okay.
They know mental health professionals working with these individuals face unique difficulties.
So what are some of those difficulties? Paint me a picture of what those challenges look like.
Imagine working with someone who experiences emotions very intensely,
Oh, yeah.
struggles with boundaries, and might even engage in manipulative behaviors.
Yeah,
It can be emotionally draining and even lead to burnout for clinicians.
that makes perfect sense.
Yeah.
So how does the quality standard address this very real risk of burnout among mental health professionals?
Well, they place a strong emphasis on regular supervision.
Okay.
It's not just about checking boxes.
All right.
It's about providing tailored support to each professional based on their individual needs and the specific challenges they face in their role.
So it's about supporting the supporters,
Yeah.
recognizing that they need care and guidance too.
Yes.
What are the goals of this supervision?
Well, it serves several purposes.
Okay.
It's a chance to monitor how someone is doing in their role, to provide guidance on difficult cases,
Right.
offer emotional support, and even address any negative attitudes that might be developing towards the individuals they are working with.
Wow.
The ultimate goal is to ensure high-quality care for both the individuals with these disorders and the well-being of the dedicated professionals providing that care.
That's so important.
Yeah.
It's a reminder that everyone involved in this process needs support and understanding.
Absolutely.
Takes a village, right?
It takes a village where both the individuals with these disorders and the professionals supporting them can thrive and feel valued.
Okay, we've covered a lot of ground.
We have.
We've explored the need for accurate diagnosis, the surprising focus on therapy over medication,
Right.
the importance of managing transitions,
Yeah.
the power of setting long-term goals, and the critical need to support mental health professionals.
Absolutely.
Whew. And my brain is already buzzing.
Yeah.
Is there anything else that really stands out to you from this quality standard before we move on?
Well, there's one more thing I think is worth mentioning.
Okay.
Well, we talked about how medication isn't the primary treatment.
Right.
The quality standard does address its use in certain situations.
Okay.
They specifically recommend that antipsychotic or sedative medications be prescribed only for short-term crisis management
Okay.
or to treat co-occurring conditions.
Right. I remember you mentioned earlier that medication isn't generally effective for treating the core issues of these disorders.
Yeah.
Can you remind me why that is?
Of course.
Yeah.
Personality disorders are complex, and they're not simply caused by chemical imbalances in the brain that can be easily fixed with medication. Remember, we're talking about ingrained patterns of thinking and behaving.
Right.
Plus, long-term use of antipsychotics or sedatives can have significant negative side effects.
Yeah, that's important to consider.
Yes, so it's really about using them judiciously and strategically.
So they might be helpful for managing acute symptoms during a crisis.
Right.
But they're not a long-term solution for addressing the underlying issues.
Exactly.
And they might be appropriate for treating other conditions that might be present alongside the personality disorder,
Yeah.
like anxiety or depression, right?
Exactly. It's all about tailoring treatment to the individual's specific needs and being mindful of potential risks and benefits.
Wow, that was a lot to unpack in this first segment.
It was a lot.
We've really begun to scratch the surface of this nice quality standard.
Yeah.
And it's clear that it's an incredibly valuable resource for anyone working with or supporting individuals with borderline and antisocial personality disorders.
It really is.
Yeah.
It provides a roadmap for providing compassionate, effective care that addresses not just the symptoms, but the whole person.
Right.
And that's what makes it so remarkable.
Okay, let's take a moment to absorb all this amazing information.
Yeah.
When we come back, we'll continue our deep dive into this fascinating topic and uncover even more insights from this groundbreaking quality standard.
Sounds good.
Don't go anywhere.
Welcome back. As we're exploring these nice guidelines, I'm struck by how much they emphasize understanding the individual's unique experience.
Right?
It's refreshing to see such a person-centered approach.
Yeah.
Considering these disorders are often misunderstood and stigmatized.
That's so true. We already talked about how the guidelines encourage individual choice in therapy and transitions.
Right.
What else in this document points to this person-centered approach?
One thing that really stands out is the emphasis on considering the individual's cultural background and personal preferences when developing their care plan.
Yeah.
It's not a one-size-fits-all approach.
That makes so much sense.
Right.
What works for one person might not work for another.
Exactly.
And we all come from different backgrounds with unique perspectives on mental health. Cultural factors can play a huge role in how we experience and respond to these challenges.
Absolutely. For example, some cultures might have different ways of expressing emotional distress, or even different beliefs about what mental illness is.
Right.
Clinicians need to be sensitive to these nuances to provide truly effective care.
Yeah.
It's about respecting and valuing diversity, not just tolerating it.
So it's about meeting people where they are, both literally and figuratively.
Yes.
I love that.
Yeah.
It's about seeing those differences as strengths, not barriers.
Yes, and this person-centered approach goes beyond just the individual. The guidelines also encourage involving family members or caregivers in the treatment process.
Yeah.
If the individual consents, of course.
Of course, family support can be so crucial in the recovery journey.
Absolutely.
They can offer a different perspective on what's happening.
Yeah, family members can provide a lot of valuable insight into the individual's behavior patterns, triggers, and strength. They often see things that clinicians might miss just because they have that long-term intimate knowledge of the person.
It's like having another set of eyes on the situation, a different lens to view things through.
Exactly. But we can't forget that involving family members always depends on the individual's consent.
Right.
It's about respecting their autonomy and empowering them to make decisions about their own care.
Right. It's about finding that balance between providing support and respecting boundaries.
Yes.
It's tricky, but so important.
Yeah.
Okay, I have to ask, was there anything in this quality standard that really surprised you? Something you didn't expect to see?
You know, I was really struck by the emphasis on physical health.
Okay.
The document really highlights the importance of addressing any physical health needs that individuals with borderline or antisocial personality disorders may have.
Why is that such a focus? What's the connection there?
Because mental and physical health are intertwined.
Yeah.
They impact each other in so many ways.
Right.
For example, individuals with borderline personality disorder are more likely to experience chronic pain and other physical health problems. And neglecting those physical health needs can make their mental health symptoms worse.
It's a vicious cycle.
It's a vicious cycle.
That's like our bodies and minds are constantly having a conversation, and we need to listen to both sides.
Exactly. The document stresses that mental health professionals should collaborate with other healthcare providers, like primary care doctors and specialists, to ensure individuals receive comprehensive care that addresses all of their needs, both mental and physical.
That's so important. It's a reminder that these diagnoses don't exist in a vacuum. We need to treat the whole person, not just the diagnosis.
Yes.
Okay, we've covered a lot of ground today, but before we move on, I want to take a moment to acknowledge how challenging it is to live with these disorders. Borderline and antisocial personality disorders can be incredibly debilitating.
Yeah.
And the stigma surrounding them can make it even harder to seek help.
You're absolutely right. It's important to remember that behind these diagnoses are real people who are struggling and deserve our compassion.
Yes.
These disorders are not a choice.
Right.
They develop from this complex mix of genetic, environmental, and social factors.
And despite the challenges, there is hope.
There is.
With the right support and treatment, individuals with these disorders can learn to manage their symptoms and build meaningful lives.
Absolutely. And that's what's so encouraging about these NICE guidelines.
Yeah.
They provide a framework for delivering compassionate, evidence-based care that empowers individuals to take control of their lives and achieve their full potential.
So well said. Now, before we wrap up our deep dive, there's one more aspect of this quality standard I want to touch on.
Okay.
It's a topic that we haven't discussed yet, but it's something that often comes up in conversations about borderline and antisocial personality disorders.
I think I know what you're referring to, the risk of self-harm and suicide.
Yeah.
It's a difficult topic, but it's essential to address it head on.
You're right. The 9C guidelines acknowledge that individuals with these disorders are at an increased risk of self-harm and suicide.
Yes.
And they emphasize the importance of assessing and managing this risk very carefully.
What's crucial here is understanding why someone might engage in self-harming behaviors.
Right.
It's often a way to cope with intense emotional pain, a way to feel in control when everything else feels chaotic and overwhelming.
It's a desperate attempt to regulate emotions that feel unbearable.
Exactly. And the quality standard recommends a multifaceted approach to addressing this risk.
Right.
This includes regularly assessing the individual's risk of self-harm and suicide, developing a safety plan with the individual, outlining steps they can take when they feel overwhelmed, teaching coping skills to help them manage their emotions in a healthier way, and ensuring they have access to crisis support services.
So it's not just about preventing self-harm in the moment, but about addressing the root causes and teaching healthier coping mechanisms.
Precisely. It's about helping individuals develop a toolbox of skills they can use to navigate emotional distress without resorting to self-harm.
And that's where therapy comes in. We talked about how therapy is the cornerstone of treatment for these disorders.
Right. Therapies like dialectical behavior therapy or DBT and mentalization-based therapy or MBT have been shown to be effective in reducing self-harm and suicidal behaviors in individuals with borderline personality disorder.
Right.
And for antisocial personality disorder, cognitive behavioral therapy or CBT can help individuals identify and challenge the thoughts and beliefs that contribute to their harmful behaviors.
So it's about giving them the tools and support they need to make different choices.
Exactly. And it's important to remember that recovery is a journey, not a destination. There will be setbacks along the way.
Right.
But with persistence and the right support, individuals with these disorders can learn to manage their symptoms and build a life worth living.
That's a powerful message of hope.
Yeah.
And it underscores the importance of early intervention and access to quality mental health care.
Absolutely. The earlier we can identify and address these disorders, the better the outcomes will be for individuals and their families.
Okay. It feels like we've explored just about everything in this incredibly comprehensive quality standard.
Yeah.
We've talked about diagnosis, treatment, managing transitions, long-term goals, supporting mental health professionals, and addressing the risk of self-harm and suicide.
Right.
It's been a fascinating and informative deep dive.
It really has. And I hope our listeners have gained a deeper understanding of these complex disorders and the importance of providing compassionate, person-centered care.
Now, before we go, I want to leave our listeners with a few thought-provoking questions to ponder. Given how important structured assessments are, how can we make sure more people with these disorders have access to them? I mean, those assessments sound really thorough.
Yeah.
But I imagine they require specialized training and resources.
That's a great point. It's about raising awareness among healthcare providers so they know to look for these disorders and understand the importance of those assessments. It's also about providing more training opportunities for clinicians so they feel comfortable administering these tools.
Yeah.
And of course, it's about advocating for better funding and resources for mental health services in general.
Right.
So these specialized assessments are more widely available.
And we talk about how medication isn't the primary treatment for these disorders.
Right.
So how do we better educate the public and even some healthcare providers about the value of psychological therapies? I feel like there's still a lot of stigma around therapy, and people might not understand how effective it can be.
It's about changing the conversation.
Okay.
We need to move away from this idea that therapy is only for serious mental illnesses.
Right.
Or that it's a sign of weakness.
Yeah.
We need to talk about therapy as a tool for growth and self-improvement, something that can benefit anyone. And we need to highlight the evidence showing how effective therapy can be for treating personality disorders and improving people's lives.
Absolutely. Yeah. And finally, what can communities do to support individuals with borderline or antisocial personality disorders in achieving their education and employment goals? I mean, it's one thing to say we want them to succeed,
right?
But how do we actually make that happen?
It starts with creating inclusive environments where people feel safe to disclose their diagnoses without fear of judgment or discrimination.
Right.
We need to provide job training programs that cater to their specific needs and offer ongoing support once they're employed. And we need to challenge discriminatory practices that prevent them from reaching their full potential. It's about recognizing that everyone has something to offer.
Yeah.
And we need to create opportunities for them to shine.
These are all such important points to remember.
Yeah.
So as we wrap up our deep dive, what's the one key takeaway you want our listeners to walk away with?
I think the most important thing to remember is that individuals with borderline and antisocial personality disorders deserve our compassion and understanding.
Yeah.
These are complex conditions, but with the right support, recovery is absolutely possible.
Beautifully said. Thank you so much for joining me on this journey of discovery. It's been eye-opening.
It's always a pleasure to explore these important topics with you.
And to our listeners, thanks for joining us on a deep dive. We hope you've gained valuable insights into borderline and antisocial personality disorders. Until next time, keep learning, keep exploring, and keep the conversation going.